Welcome to another important program today on Ogijo Olopo TV. We are having our brother here, Ambassador Tijani Hassan. Ambassador Tijani Hassan came to our studio today to advise and talk about eyes care. Eyes care. My own name is Mohammed Aliyu Obaka, also known as Ogijo Olopo. Before we go into this program properly, we would like to go on this short break and come back. Welcome back. Can we meet you? Can we know you properly?
Yeah, my name is Tijani Hassan, Igala Youth Ambassador, Lagos State, and also in making the Ogata of Unigala General, Lagos State. I work for Lakem Eye Hospital as the hospital administrator. So by the special grace of God, as we all know today, we just really want us to look at the eyes and talk about the eye care, and also what are the causes of eye problems, and within the sense we'll now look at what are the prevention that one has to really give. We all know, as a little layman, you all agree with me that the eye is a sensory part of the organs that is used for sight, and the eyes have so many functions that you say. Apart from seeing, the eyes also contribute 50% of the sensory listens to the brain, pass the message to the brain in which other functions of the brain really works. Looking at the eye as a peculiar, eye is life itself. The moment you don't have that sight, or you have a low vision, then you are as good as death. So starting the discussion improper, I might not be able to do it justice because I'm not an ophthalmologist, neither am I an optometrist. But my experience in eye care industry, I should be able to share little light with our viewers on the importance on eyes, and also how to take care of our eyes, because eyes itself is life. Looking at the eyes, there are causes which we have myopia, we have ametropia, and we have astigmatism, and the likes like that. But looking at a myopia, who is a myopia? A myopia is that patient that is short-sightedness. Before I really give us more explanation on myopia, it is important for us to know. There was a day I was driving with a friend, and all of a sudden I just saw a plate number, and I was able to read out the plate number, and I was surprised that how come did you see this plate number? It wouldn't be able to. And I said, in that case, you can examine yourself, and what you need to do is that put a distance between yourself and 6 meters, and see, you should be able to read any words that is within 6 meters to yourself. If you cannot read that, that means at that particular time you are short-sighted. You cannot see anything from afar. So it's a natural disease that can happen to one and can be hereditary. As most cases, but when you are short-sighted, what you need to do at that particular time is to consult your doctor, consult your eye doctor, and then of course there is a way for it. And the hypermetropia also has to do with the long distance. There are some patients that can see from a very afar, but they cannot see the letters that are also clearer. And we have allergic conjunctivitis, we have bacterial conjunctivitis, and some other minor eye care problems that do happens to one on a daily basis, as you can see. But what is expected as an individual is, how do we now prevent this particular thing? It's most important that you have to constant wash of our faces, because when you do that, the bacteria that are going to be on face, you have washed that away. If you fail to wash your faces, and the bacteria, that's come where you come allergic conjunctivitis, and that with some medications, eye drops, you are okay. Some without even applying any eye drops, you see them, yes, that they feel very much okay as far as the eye care is concerned. But I also need to let our viewers to know that looking at all these eye problems as it is, then there are some has to be medical treated, and also some has to be surgical. For instance, now we have what is called retina. Retina is a part of the eyes that's used to give visions to the sight. So the moment your retina is blurred, then there's no how you can really get to see. So what are now the causes? Some of the causes you see of those that causes the high problems that we see is number one, with a patient that has a cataract. Cataract now could be a trauma that could happen to one eye, either by trauma, by hard blow, or injury. And when you have that, it affected the lens. And the only way it has to be cured at that particular time is that the lens has to be replaced, and that particular patient gets to see better. But in cases like glaucoma, as it may be, it's a tip of the eye, and that is what you call a loss of vision. Because the moment light cannot supply to the retina cannot give light to the eyes, and if you cannot see, there is no how. That's where you have some patients who says they have blood. But coming to, we can practicalize these things that on your home before going to a doctor. You can even self-examine yourself. How do you know at the first time? You can just close your eyes and try and see. How do you see with your right eye? Are you seeing comfortable with it? Then you do the same in the other eyes. If you feel that some of the visions get blurred, you now know that at that particular time you have to now see the doctors, and which they have to carry out some investigation, the tonometry, which has to do about your high pressure. Because if your high pressure is just as a normal patient should have hypertensive, that you are hypertensive, you have to treat. The same thing happens to the eyes. When you overstrain the eyes, you read so much and you do a lot of things with your eyes. At that time, the eye is straight, and most times it will really cause blurred visions. And when that happens, it can either be ocular hypertension or glaucoma suspects, as it may be. So it is when you now go to a consultant, a specialist, then the procedures are carried on. After that procedures be carried on, you will now diagnose and know what exactly ailments you really have.
Thank you very much. You agree with me that a lot of people believe that using breast milk, urine, and all that. What do you have to tell them?
Yeah, thank you very much. Going by that, self-medication is as deadly and dangerous than as the name implies, because I call it as a result of ignorance, because you cannot go on self-medication. The urine and the likes have a whole lot of chemicals in it, and that within no time can destroy the eyes and can just make one go completely blind.
Wow.
We've had a situation of a young guy, educated for that matter, but then, and he had what's it called, Apollo, as a normal say, which is as the same as the conjunctiva, bacterial conjunctiva is a severe conjunctivitis. And the next thing he told was advised, why not go and put urine? And the next thing he applied urine, then after a few days, the eye started perforating. And as such, he has to rush into the hospitals. And luckily enough, when he now went to a particular pharmacy and said, this is what I use, this is could not really got, and they give him an eye drop. And he applied that, and that eye degenerated to the extent that there was now a corneal ulcer in the eye. So you can now see from a minor eye treatment that maybe perhaps just seeing an ophthalmologist or an optometrist as a case, because it's a minor allergic cases. But because of ignorance, you understand, and self-medication, such disease might just really have to really. So self-medication is not really advisable at all.
What advice do you have for our young girls out there that fix eyelashes and all that?
Yeah, thank you very much for that question. It's important, as our ladies will call it, that is fashion. Yeah, but within anything, number one, we have to really be grateful to God Almighty. God has created you perfect, and we should be contented with. It's even against the principles of religion, irrespective of Christianity or Islam. Try to make yourself order, and artificial disease will come. So my advice to our beautiful ladies out there, sisters who think that without their eyelashes they are not as beautiful as they are created, they are really wrong as far as that perspective is concerned. And so it's just my candid advice that they just have to do away with the eyelashes.
Thank you very much, comrade. This is how far we can go on this program. Please, we advise you take proper care of your eyes, because without eyes, he has told us, you are as good as dead. So if you know what that means, You have to be very, very careful. Thank you for being with us, Mr.
You're welcome.
TJ. Thank you for watching, viewers. We will meet you next time and discuss further.